What if I told you that one medical decision could dramatically improve blood sugar control, reduce medication dependence, and even send type 2 diabetes into remission, regardless of income level or social background? Today, we're diving into groundbreaking research that's changing the way doctors think about diabetes treatment, and the results may surprise you. Before we begin, please take a moment to like this video and subscribe to our channel if you value clear, science-based health information. It truly helps us reach more people who need reliable education. Also, be sure to check the description box below for full sources and references used in today's video so you can explore the research yourself. Hello, I'm Pamela. I analyze the latest research on blood pressure, diabetes, and cardiovascular disease, translating complex scientific findings into clear, practical insights through educational video content. My goal is to help you understand not just what the science says, but what it actually means for your health and everyday decisions. Now let's get started. Type 2 diabetes is one of the fastest growing chronic diseases in the world. Millions of people are affected, and many struggle not only with blood sugar management, but also with obesity, high blood pressure, heart disease, and medication side effects. For years, treatment options have focused on lifestyle changes and medications. More recently, GLP-1 drugs such as semaglutide and tirzepatide have gained massive attention for their ability to reduce appetite and promote weight loss. But there's another option that has existed for decades: bariatric surgery. And new long-term research suggests that surgery may still outperform medications, even the newest ones, across all income and social groups. Let's break down what this actually means. A major long-term clinical trial followed patients with obesity and type 2 diabetes across 4 major U.S. cities: Boston, Cleveland, Pittsburgh, and Seattle. Participants were randomly assigned to either medical therapy and lifestyle management or bariatric surgery options such as gastric bypass, sleeve gastrectomy, or adjustable gastric banding. Researchers tracked outcomes for up to 12 years, a rare and extremely valuable long-term dataset. Here's what they found. Patients who underwent bariatric surgery experienced greater weight loss, around 28% compared to 10% with medications, better blood sugar control, reduced need for diabetes medications, higher rates of diabetes remission, lower cardiovascular risk factors, improved long-term metabolic health. And importantly, these benefits were consistent across different income levels and neighborhood deprivation categories. In simple terms, surgery worked better no matter where people lived or how much money they made. Dr. Mary Elizabeth Patty, an endocrinologist and lead researcher, emphasized something many people overlook. Diabetes is not just about biology. It's deeply connected to food insecurity, limited healthcare access, long work hours, stress, financial strain, transportation barriers, insurance limitations. For someone working 2 jobs, preparing specialized meals, exercising regularly, attending appointments, and navigating insurance approvals can be overwhelming. That's why researchers wanted to see whether social disadvantage affected treatment success. Surprisingly, bariatric surgery showed strong benefits even in communities facing higher socioeconomic challenges. Many people assume surgery works only because the stomach becomes smaller, but the real magic happens at the hormonal level. After bariatric surgery, the gut releases more GLP-1 hormones naturally. Appetite decreases, insulin sensitivity improves, blood sugar regulation becomes more efficient, metabolism shifts in a healthier direction. Interestingly, GLP-1 medications attempt to mimic these same hormonal pathways. So in a way, surgery and medications work on similar biological systems, but surgery activates them continuously without relying on weekly injections or insurance approvals. Dr. Patty explained it clearly. Surgery provides a sustained activation of appetite and metabolic regulation through the gut-brain connection. GLP-1 drugs are powerful tools, but they come with limitations: high monthly costs, insurance coverage restrictions, prior authorization delays, supply shortages, side effects like nausea, long-term adherence challenges. Many patients stop treatment not because it doesn't work, but because they lose access. Surgery, on the other hand, is a one-time intervention with lasting metabolic effects. That doesn't mean surgery is easy. It requires preparation, recovery, lifestyle changes, and medical follow-up. But its durability is one reason researchers continue to highlight its value. One key factor is the amount of weight loss. If someone needs to lose 20 to 30 pounds, medications may be sufficient. But if someone hopes to lose 80 to 100 pounds or more, surgery is statistically more likely to achieve that outcome. And greater weight loss often leads to better diabetes remission and cardiovascular improvements. Experts agree, there is no single solution that fits everyone. Dr. Melanie J. from NYU explains obesity as a lifelong disease that often requires ongoing management. Some patients may benefit from combining approaches, surgery plus medications, lifestyle therapy plus pharmacology, personalized long-term strategies. The most important question becomes, what is the best choice for the individual patient? That decision depends on medical history, severity of diabetes, weight goals, access to care, financial considerations, personal preferences, risk tolerance. Despite strong evidence, bariatric surgery remains dramatically underutilized. Only a small percentage of eligible patients ever receive it. Why? Several reasons. Fear of surgery, misconceptions about safety, lack of referrals, insurance barriers, cultural stigma, limited awareness. However, modern bariatric procedures are far safer than many people realize and are supported by decades of data showing long-term benefits. If you or someone you love has type 2 diabetes and obesity, this research delivers an important message. You deserve to know all your options, not just medications, not just lifestyle advice, not just short-term fixes, but the full spectrum of evidence-based treatments. Whether that includes surgery, medications, or a combination depends on personal circumstances, but informed decision-making is critical. Researchers continue developing newer GLP-1 and incretin-based drugs that may further improve outcomes. However, long-term durability, affordability, and real-world access will determine whether medications can match surgical results over decades. Experts agree that future care will likely be more personalized, matching the right therapy to the right patient at the right time. Let's summarize what matters most. Bariatric surgery outperformed medical therapy in long-term diabetes control. Benefits were consistent across income and social backgrounds. Surgery activates natural hormonal pathways that regulate appetite and metabolism. Medications remain valuable, but face access and adherence challenges. Treatment should always be individualized. Patients deserve full transparency about all available options. Diabetes is not just about blood sugar numbers. It's about quality of life, long-term health, heart disease prevention, and giving people the tools they need to succeed. Science continues to evolve, and as patients, caregivers, and health advocates, staying informed empowers better decisions. That's exactly why this channel exists. If you found this information valuable, please like this video, subscribe to the channel, and share it with someone who may benefit. Your support allows us to continue producing evidence-based health education. And don't forget, check the description box for full study references and source links so you can explore the science behind today's discussion.